Hi, my name is David Pozo, and I'm going to talk about novel familial cardiac arrhythmia syndrome with widespread ST segment depression. Definition: the novel familial cardiac arrhythmia syndrome with widespread ST segment depression was described by H. Bongard in 2018. It is characterized by widespread concave upward ST segment depression. This syndrome is associated with atrial fibrillation and sudden cardiac death due to ventricular tachycardia and ventricular fibrillation.
And hit the like button. Cardiac arrhythmia syndrome with widespread ST segment depression is described in this video. Have fun and enjoy. In November 2018, Henning Bongard and co-authors described a new electrocardiographic pattern associated with the sudden cardiac death. They found this pattern in 5 unrelated families from 3 different countries. ECG reveals a deep and persistent concave upward ST segment depression in the leads 1, 2, AVL, AV foot, V2 to V6. Often ST segment elevation is registered in the leads V1 and AVR. The ST segment in precordial leads may be notched. The notch is the most prominent in the leads V3 and V4. The ECG changes are permanent and are worsened upon exercise. This ECG pattern was being registered even in a child of 6 years of age. The atrial fibrillation develops frequently in such patients, and in few years ventricular tachycardia or ventricular fibrillation develop, leading to sudden cardiac death. But in young people, usually ventricular tachycardia or ventricular fibrillation occur without the previous atrial fibrillation. Coronary angiography reveals no coronary artery disease. Systolic ventricular function usually is normal, but sometimes the mild ventricular dysfunction may be found. Genetic tests include genes associated with cardiovascular diseases are negative. Studying the genealogy of affected patients, an autosomal dominant pattern was identified. Often, relatives have similar ECG changes. Often, affected people are completely asymptomatic, but symptoms appear when the atrial fibrillation, ventricular tachycardia, or ventricular fibrillation develop. Non-sustained ventricular tachycardia may result in a syncopal episode. The ventricular tachycardia often transforms into the ventricular fibrillation, leading to sudden cardiac death. This syndrome is not well understood. Probably, channelopathy plays a key role in the pathogenesis of this syndrome, but the gene associated with this disease is still not detected. It's unknown whether arrhythmic drugs can prevent the sudden cardiac death. An implantable cardioverter defibrillator is recommended for the patients that survived ventricular tachycardia or ventricular fibrillation.
Application in medicine. Molecular cardiology has become an important tool to study and understand the etiology, pathogenesis, and development of familial cardiomyopathies and channelopathies, and is beginning to change clinical practice. The results of genetic testing can be complex, although a result may be categorized as positive, negative, or uncertain. Its clinical significance strongly depends on the patient's personal and familial history, and the clinical context should never be forgotten when interpreting the variants identified. Genetic testing should be offered to index patients who fulfill diagnostic criteria for genetic cardiovascular disease. A comprehensive clinical evaluation should precede genetic testing, so precise clinical diagnosis is extremely important in guiding the type of test that needs to be performed. As discussed, testing is recommended in family members only when a gene mutation disease-causing mutation has been already identified. Pros and cons. Advantage. In current practice, genetic testing can be used in clinical affected patients to confirm diagnosis or to formulate a differential diagnosis among overlapping phenotypes or between hereditary and acquired non-genetic forms of disease. The general goals of genetic counseling are to increase patient knowledge and awareness about the disease and its genetic aspects, and to ensure the patients can control their feelings about their condition, resulting in the ability to make autonomous choices for themselves and their relatives. Disadvantage. The accuracy of genetic tests to detect alteration varies depending on the condition being tested for. Genetic testing may not be able to detect all genetic defects causing a genetic disease, as this is an evolving field. A negative result today may be a positive in the near future. In some cases, a genetic test may not be able to provide helpful information about the genetic etiology of the disease. Sometimes it can be difficult to distinguish between a disease-causing gene alteration from the background noise, the so-called BUS, which means that although the testing laboratory detected DNA alteration, there was not enough evidence to classify the alteration as deleterious or neutral. Therefore, the variant has an uncertain clinical significance.
Genetic testing involves looking at your DNA, the genetic instructions that make you, you. Your DNA is fundamental to your health and well-being. Throughout your life, these instructions also influence your health and risk for disease. Everyone has variations in their DNA, which is what makes us unique. Some of these variations have little effect on a person's health, but other variants can increase the risk of developing disease. When someone is sick and their doctor doesn't know why, genetic testing can sometimes provide a diagnosis, which can confirm the treatment plan, or, in some cases, help identify new or better treatments. This is called diagnostic testing. Proactive genetic testing can also help healthy people plan for the future. Recent data suggests that 1 in 6 healthy people carry a genetic variant that increases their risk of developing a medical condition. For example, some genetic variants can increase your risk of cancer. Knowing if you're at an increased risk can empower you to work with your doctor to prevent disease or detect it at an earlier, more treatable stage when survival rates are higher. In some cases, genetic testing can also guide your doctor towards the best treatment options. Another type of genetic testing can help you understand how your genes may affect your future family. With carrier screening, you can learn your risk for passing on an inherited genetic disorder to a child, even before you're pregnant. Almost 97% of babies are born healthy, but of babies who have a genetic disorder, more than 80% are born to parents with no family history or symptoms. By knowing your risk ahead of time, you can make informed reproductive choices. No matter your stage of life, genetic testing can help you take control of your health.
Most people think of genetic testing as a mail order kit that helps you discover your genetic ancestry or common conditions. But in order to unlock the vital information within your genome, you need more than a single test. Inside your genome, that complex code that runs the systems in your body, exists more than 20,000 genes that are indicators for genetic conditions. And the medical industry has developed over 75,000 tests to identify different ways genetics can affect your body. That's good news when you consider that 10 to 20% of the world's population carries at least one of 6,000 known genetic diseases. The bad news? Finding your way to the right tests on your own is extremely complex. At Genome Medical, we simplify things for you. by helping you and your doctor navigate this complex genetic testing landscape. We connect you with genetic specialists who can evaluate your medical history, health risks, and select the correct tests for you. Once your genome is tested, we don't just send you your results. We help you interpret them, answer your questions, and guide you toward a healthier future so you can take action. Most people are referred to genetic testing after exhibiting major signs of disease or after being diagnosed, and some only if they have a family history of genetic disease. But even a healthy family history doesn't paint a reliable picture of your own genetic health, because every person's genome is unique. Being proactive and consulting with a genetic specialist could potentially save your life or a loved one's. Because your genetic journey didn't begin with you and doesn't end with you. Knowing what genes you may pass on or have been passed to you can help you make decisions in the future. These roads to genetic health are complicated, but you don't have to travel alone. Genome Medical is the first nationwide medical practice specializing in genetic health. We evaluate your genetic risks, recommend and order the appropriate tests, and help integrate the results into your care, while guiding you every step of the way with a personalized clinical care plan for you. Isn't it time for you to get on the road to a healthier future? Genome Medical.
Issue applied in Ecuador. Cardiovascular diseases are the first cause of death in the country. Cardiac arrhythmias caused around 168 deaths only in 2016. Conclusion: Bungard syndrome is a disease with an uniform ECG changes with marked, persistent, non-ischemic ST segment depression that can lead to development of atrial fibrillation and ventricular arrhythmias, and in older persons some degree of left ventricular dysfunction. Genetic testing is one of the most useful tools to prevent this disease. Thanks.